Hi guys, it's Abby here, and I am presenting on the reproductive system of the males and females. So, let's get started. The reproductive system. The reproductive system is a collection of internal and external organs in both males and females that works together for the purpose of procreating. Due to its vital role in the survival of the species, many scientists argue that this is the most important system in the entire body. The male reproductive system. The male reproductive system consists of two major parts, the testes, where the sperm is produced, and the penis. The penis and urethra belong to both the urinary and reproductive system in males. The testes are carried in an external pouch known as the scrotum, where they normally remain slightly cooler than the body temperature to facilitate sperm production. I listed down here in the bottom the internal organs and the external organs. The function of the male reproductive system. The function is to produce, maintain, and transport sperm and protective fluid, to discharge sperm within the female reproductive tract during sex, and to produce and secrete male sex hormones responsible for maintaining the male reproductive system. Diseases of the male reproductive system are prostate cancer. The usual treatments for prostate cancer are surgery, radiation, therapy, watchful waiting, and hormonal treatment. Next, we have erectile dysfunction, a common condition that affects about 1 in 10 males on a long-term basis. Treatment includes lifestyle change, medication, mechanical devices, therapy, and surgery. And then prostasis. It involves swelling or inflammation of the prostate gland and can cause painful or difficult urination and ejaculation. Nearly half of all men experience symptoms of prostasis at some point during their lives. Treatments include antibiotics, anti-inflammatory agents, and alpha blockers. And sexually transmitted diseases. This pertains to both males and females, so you'll see it on both of my slides, but it's an infection transmitted through sexual contact caused by bacteria, viruses, or parasites. Treatment includes antibiotics and antiviral drugs. Now we'll move on to the female reproductive system. Here's a picture. Alright, the external structures of the female reproductive system include the clitoris, labia minora, labia majora, and the Bartholin's glands. The major internal organs of the female reproductive include the vagina and uterus, which act as a receptacle for semen, and the ovaries, which produces the female's ova. The vagina is attached to the uterus through the cervix, while the fallopian tubes connect the uterus and to the ovaries. The function of the female reproductive system. It's quite lengthy. It produces the female egg cells necessary for reproduction, called the ova or octocytes. The system is designed to transport the ova to the site of fertilization. Next is the conception. The fertilization of an egg by a sperm normally occurs in the fallopian tubes. Next, the next step for the fertilized egg is to implant into the walls of the uterus, beginning the initial stages of pregnancy. And if fertilization or implantation does not take place, the system is designed to menstruate, the monthly shedding of the uterine lining, also known as the period. In addition, the female reproductive system produces female sex hormones that maintain the reproductive cycle. Next, we have the diseases of the female reproductive. I was quite surprised on how many more diseases the females run into versus the males, but our system seems to be a little more complex. We have ovarian cancer, cervical cancer, sexually transmitted diseases, menstrual cramping. I was surprised this was a disease, but in the site, I think it was WebMD, I had found that. Vaginal yeast infections, endometriosis, pelvic inflammatory disease. Next is our female reproductive disease in depth. I listed common ones, and then I chose one of the common ones to go in depth with, and I chose cervical cancer. It is the most common cancer in women under 35. However, it affects women of all ages. It is estimated that there are around 49,000 women living with and beyond a cervical cancer diagnosis. Long-term effects are the 5 most common consequences are changes in sex life, which is 67%, fatigue, which is 64%, menopause, which is 56, bowel difficulties, 54, and bladder difficulties, 54. Treatment options vary depending on the person and what they're looking for, whether they want to have kids, but these are the most basic, which is depending on the type and stage of your cancer, you may need more than one type of treatment. For the earliest stages of cervical cancer, either surgery or radiation combined with chemo may be used. For later stages, radiation combined with chemo is usually the main treatment, and then chemo by itself is often used to treat advanced cervical cancer. And then this is my citation page with all the sites that I use to find my information. And that is my presentation. If you guys have any questions or want to converse about anything, please comment down below. And thank you for watching. Bye!